thank for the organizers and for the Hirschberg Foundation to invite me to this talk. The incidence of obesity, metabolic syndrome, and type 2 diabetes mellitus, which are all characterized with insulin resistance and compensatory hyperinsulinemia, is reaching so alarming rates in the developed world. As Guido mentioned, 65% of the adults in the US are over BMI 25 and 30 are over BMI 30. Currently, there are 400 million obese people in the world, and the prediction is that within 4 years, 2015, there's going to be 700 million. So it's going to be a huge number to deal with, and unfortunately, it will mean that many of the cancers, which has been mentioned before, first of all, the pancreatic ductal carcinoma, but again, colon cancer, gallbladder, esophagus, kidney, prostate, breast, and endometrial, and the hematologic diseases like the leukemia, multiple myeloma, and non-Hodgkin lymphoma will most likely increase. There are many theories how obesity and diabetes, type 2 diabetes mellitus will lead to cancer development. One of the key would be the insulin resistance with the IGF and insulin receptor signaling, the PI3 kinase, and through the other pathway, RAS-RAF, which all leads to cell survival and proliferation, and then at the end, cancer. Then our question was that, is there any crosstalk mechanism between the insulin and GPCR signaling in this human ductal pancreatic cancer cells, whether that would promote the cancer cell proliferation, and then could we make any good point of it and make a potential target for any therapy in the future? Through a series of in vitro experiments, we finally came to the conclusion that this interaction, this crosstalk, occurs from the insulin signaling pathway around mTOR level, goes to the GQ-PLC beta level, so that would be somehow the interaction. So the next question was whether can we disrupt this interaction? Is there any drug available which would help us to disrupt this crosstalk? There is a drug, metformin, which has been used in Europe for 40 years, here in the United States for 20 years. So we injected 2 million cells and then treated with IP injection every day, 200 milligram per kilogram dose. And then after 25 days, when the control tumors were quite big, the metformin significantly reduced the growth of these cancer cells. So this is the tumor weight at the tumor volume at the end of the experiment. Now, currently, metformin is available for patients only oral form, only as a capsule. So then it was interesting to see whether the oral administration would change the tumor growth in these animals. So again, we injected subcutaneously the MIA-PACA2 cells, and then in this case treated the animals in the drinking water with 2.5 milligram per milliliter metformin, changing every third day. And then after 28 days, you see that the control grew just as previously, and the metformin treated were just as effective as the IP injections. So the conclusion of this part of my talk would be that insulin and IGF receptor and GPCR signaling system, there is a crosstalk between these signals, and it's a synergistic cellular effect, including the DNA synthesis and proliferation. This crosstalk, which occurs through the PI3 kinase AKT-mTOR pathway, and metformin disrupts this crosstalk through AMP kinase. Furthermore, in vivo, the metformin inhibited the growth of the PANC1 cells, MIA-PACA and PANC1 cells in xenografted mice. So it could be actually considered as a potential candidate in the anti-cancer treatment strategies.